Female genital herpes HSV-2 is a stubborn affliction that oftentimes has no outward signs or symptoms. We will attempt to bring to light some of these in the following text. What is female genital herpes? Also referred to as HSV-II, it finds its home in the sacral ganglion region located at the base of the spine. From there, it recurs in the genital area in the form of blisters or pimple-like pustules. These lesions form, break and scab until completely healed. Breakouts do vary in length of time and severity, usually lasting anywhere from 10 to 14 days. The first outbreak is commonly the most painful and longest lasting, and subsequent breakouts can happen weeks or months after. Your initial herpes breakout will usually occur between 3 and 30 days after your initial contact with the virus. Female genital breakouts occur vaginally, rectally, and sometimes are found intrauterine. In more severe cases, people may experience flu-like symptoms and swelling of the glands. There is as yet no cure for herpes, but over time breakouts will become less severe and occur less often. It is important to note that although this is a sexually transmitted disease (STD), female genital herpes can be transmitted in other ways besides vaginal or anal intercourse. Herpes can be transmitted through all forms of sexual contact: mouth-to-mouth contact, mouth-to-genital contact, and adult toys. A person can be infected without outward signs, that is, blisters or scabbing on the already infected partner. Genital herpes sores are often mistaken for a simple pimple when in fact they are a herpes blister, and people unwittingly infect an unsuspecting partner. HSV-II can also be transmitted from mother to child during birth, and if an outbreak is present, the physician may opt for a cesarean birth. Although genital herpes is incurable, there are quite a few of homeopathic, over-the-counter and doctor-prescribed remedies that will lessen the pain, cut the duration of the breakout. Keeping stress to a minimum and a healthy diet are the best and easiest ways to combat future outbreaks. Many of these treatment ideas can be found in any number of books or research materials. The herpes virus in females is diagnosed most often in one of two ways: blood tests or visual inspection. Tests for HSV-II antibodies can be performed by a physician to confirm infection. The outward and obvious presence of blisters can also give a visual confirmation of HSV-II infection. Genital ulcers can be found in both men and women, but transmission can be lowered with use of latex condoms. Oftentimes the infected person shows no outward signs or symptoms, but can still infect an unknowing partner. Moreover, any infected person showing outward signs and symptoms should not engage in sexual activity. We hope we have shed a bit more light on the subject of female genital herpes and encourage you to investigate further.